So today we're going to talk about the beginning of a discussion about the Medicaid program in the United States. And it's only available to legal residents of the United States. So nobody's who's an undocumented is going to be able to get into a Medicaid program. There's even more issues for immigrants. They have to, once they want to immigrate illegally, then they have to not get, if they get on Medicaid, they're done. They're never going to be accepted for immigration. They have to not take government money. Eligibility is tied to income and disability or some combination of income and disability status, and also your wealth. So if you own a mansion, but your income is very low, you won't get covered. You are allowed in most states to own a house, a small property. Some states allow you to have a car, but so if you think about what I just said, does anybody think this probably is a little complicated?
I
Yeah,
think
I do too. So here it is. So this is how you get into Medicaid. Um, on the positive side, it's a very comprehensive benefit package, often with minimal copays or none. Um,
I have a
so that's
question.
good. It includes pretty much everything. Maybe not massage therapy, but it includes drug treatment plans and very broad coverage, surgery, pharmacy, has to include pharmacy. And some will have social supports like transporting people, getting people a ride to the doctor's office. And then dental care for all children who are covered, but not adults. So your mouth becomes unimportant to Medicaid when you turn 19. Uh, Maybe the best answer is I don't know exactly how it's done. I can tell you that farming, the accounting for farming turns out to be really complicated. And some years they can make tons and tons of money when the weather turns out well. And Wisconsin, we have dairy farming in Vermont. We're known for it. But really, Wisconsin has 10, 20 times more than we do. So if Wisconsin has a really bad year for the weather, then regardless of what happens here, milk costs will go up and our dairy farmers will do well. So, their income is highly variable. I have no idea how Medicaid deals with that. I have a friend who works 4 or 5 months a year at a ski resort. And so he's on Medicaid when he's not working and he's not on it when he is. So he's learned how to kind of apply for Medicaid and get into it. So, the main idea is, yeah, it's complicated. And I don't know the answer to your question, so I'll leave it at that. Sorry.
Thank you.
Try to be honest about that. Other criteria are optional. States can opt out of providing them or set stringent eligibility criteria. So it turned out the Supreme Court decided that Obama's effort to expand Medicaid to people who are slightly less extremely poor, in other words, rather than 100% of poverty, 138% of poverty, this is not an income level that any of us would like to have to live in. But anyway, there were still 10 states that refused the Obamacare expansion, even though this Obamacare, the federal government pays 100% of it for the first 3 years and 90% of it unto eternity, but the states didn't want to cough up the other 10%. Think about the implications for the hospitals in that state, who are much less likely to get paid for the hospital care their population needs if the patient has no coverage, and typically people who are uninsured aren't exactly wealthy. So that's an issue. So Obamacare Medicaid expansion is optional for states. Dental for adults could be covered if the state wants to. Eligibility for kids may range from 141% of the federal poverty level, and in some states, 380% of the federal poverty level. And we're going to give some examples of that a little bit later. Eligibility for kids and parents for the child's first year of life varies up to 138% of the federal poverty level. But I mean, the bottom line here is you got to be pretty poor to get into Medicaid, even with the expansion. And 40 out of 50 states are shoving Medicaid patients into managed care, a topic which we'll be discussing more next week, but not today. So here we're going to compare two states, Vermont and Mississippi. And let me try to get out of slideshow. Well, I'm trying to get into slideshow and don't see it. All right, well, anyway, so it's going to stay small. Sorry about this. So, and I'm looking without my glasses. So, in these two states, Vermont and Mississippi, about a quarter of the population is low income. And the uninsured rate in Vermont is very low. It's like 2 or 3% or most 4. But on the other side, in the Mississippi side on the right, the uninsured rate in Mississippi is, hovering around 15 to 20%.
Dr. Malek,
Yeah.
you can just click that slideshow button at the top right next to share, and I should be able to make that bigger for you.
Oh. Whoa. I thought there was one version of PowerPoint, but I seem to have two and two different slideshows. Maybe I'll be able to see this with my glasses. Okay, so Vermont accepted the Medicaid expansion, so they've got a whole lot more people insured, and as a portion of their poor population. But it doesn't really, we haven't found this so far, but Mississippi has way more people who are in poverty than Vermont does. So nonetheless, Vermont covers 2 and 9 adults aged 19 to 64 and 4 and 9 children under 18 or 18 and under. And so we've got, in other words, 44% of our children covered. Let's go over to the Mississippi side. And Mississippi has only 1 in 7 adults covered. But while Vermont only had 44% of children covered, they have 50%. So for adults, Mississippi's having less Medicaid coverage, for a lot less Medicaid coverage for adults, but Vermont has less Medicaid coverage for children. And the reason why here is that, child poverty is extremely common in the United States, much more common than poverty for people over age 55. And Mississippi has so many children raised in poverty that even though they have these worst possible eligibility criteria for Medicaid, they still end up with large numbers of children covered. And so we mentioned earlier that disability gets you Medicaid coverage, permanent disability. And so in Vermont, 5 and 8, which would be 62% of nursing home residents, have their coverage through the Medicaid program. So what I'm getting at here is that Medicaid is a big source of coverage for adults who are disabled late in life. This population is disproportionately white and female, just something to think about for later points in the internship. And they're getting coverage through the Medicaid program, whose original intent was to cover people who are very poor, but has become the predominant form of insurance for elderly people who need long-term chronic care. Because they give their assets, they either lose all their assets to spend in a nursing home, or they find a lawyer who can somehow get those assets transferred to their children. And the taxpayers end up funding their long-term care. So that's an important part. So 3 and 4 nursing home residents in Mississippi are covered through Medicaid. So 1 in 5 Medicare beneficiaries in Vermont also has Medicaid supporting all the co-pays that Medicare leaves people. Yeah, that hasn't been covered yet in the internship unless Ken mentioned it, but it'll be mentioned a lot more Monday and Tuesday next week about all that Medicare doesn't cover. But if an elderly person is not only old but poor, and they're poor enough to qualify for Medicaid, Medicaid will cover a lot of those co-pays. By the way, that population, we use a lot of words that are ambiguous, like when I keep using the word own and I should have said employed by, you're going to hear the word own again, but here you're also going to hear the term dual eligible. And these are people who are on both Medicare and Medicaid, but the term dual eligible get bandied about a lot. You get there either by being old and poor or being younger and disabled, chronically disabled, and you've used up your assets. So those are the two ways to become dual eligible. And they're poor and sick. And anybody want to guess what their healthcare costs are like annually? High or low? Would you guess?
I'm sure they're
Through the
really
roof.
high.
Absolutely. They're through the roof. And so they're typically the most expensive population around. Um, so a lot, 3 in 7 people in Vermont with disability gets in. So Mississippi's much more stringent about who they allow to be called chronically disabled. If they have back pain, whatever, go live with it. We don't care. So Vermont, it's easier to get into Medicaid through disability. So here's more comparisons. So another issue is okay, so Medicaid is a matching program. And you're going to encounter this in Canada as well. And in Canada, the provinces run their provincial health programs, but the federal government gives them a certain amount of money. It's the same thing with Medicaid here, that the state is going to spend a certain amount of money on Medicaid, and the federal government will match that amount of money. So let's say the state, let's do, so basically in Vermont, the federal share is 56%. So if Vermont spends $44 million on Medicaid, their Medicaid program, the federal government will then give us $56 million. And this is if our Medicaid program total cost is 100 million. Does everyone understand that? You want to ask a question? Okay, so let's compare that to, and by the way, weird, that was not good. So in the Medicaid expansion, for the portion of the Medicaid population that's in the Medicaid expansion, the federal government pays 90% rather than 56%. So as is typically the case in the United States, it's complicated. Now let's compare this to Mississippi. Mississippi is so poor, one of the poorest states in the country, that the federal share is 78%. And then, of course, 90% if they were to get into the Medicaid expansion, which they haven't done. So this is just routine, the way the chart works. But Mississippi's not even in the Medicaid expansion. So basically, they get $78 for every 22 they spend. So for obstetrics, 40% of births in Vermont were covered by Medicaid. In Mississippi, it's 60%, reflecting poverty. And Vermont has adopted the 12-month postpartum coverage. So in other words, the Medicaid program allows a state to provide coverage to women who are not that poor, but are semi-poor. And Vermont is as generous as it can be to provide 12 months of postpartum coverage before they dump the woman whose income is a little too high. And on the other hand, Vermont does not cover 12 months of continuous Medicaid eligibility for children. I actually think that's incorrect. Vermont has a history of taking advantage of every means possible to ensure their children, and our coverage goes up as absolutely as high as it's allowed, and I don't know the reason for that. And in Mississippi's case, they dump women after as early as they can, which I think is either 6 or 12 weeks, I don't know which, instead of extending it for an entire year. But they do cover their children up to 12 months. And as I said, Vermont has some other strategy to give children coverage, and apparently it's not that particular wing. Because as we all know, the U.S. healthcare system is complicated. So 60% of births in Mississippi were covered by Medicaid as opposed to only 40 in Vermont. This is because they're poor in Mississippi. Those that hold favorable views of Medicaid, and what you're seeing here is those that didn't get good care. I actually don't want to get into this because I don't want to spend time interpreting it, but you can look at this later. So I'll try to get my slideshow to where you can find it. And in general, people who are very sick don't like their health coverage, and people who are not sick say they love their coverage. And I think that's what that was getting at. So here's proportion of the population covered through the Medicaid program. And in Vermont, I can't tell what time it is.
1:51, 11:51.
Okay. Can you let me know when it's noon?
Yeah.
Okay, thank you. So proportion of people who are covered through the Medicaid program in Vermont, it's very high. In New Hampshire, right next door, it's very low. And notice that if you go back to Mississippi, so Mississippi is a very, very poor state, but they're so stingy in the optional, the optional part of what they could or could not provide, that Mississippi doesn't even has a higher percentage in their Medicaid program as Vermont and New York, which are wealthier. So that's of interest. On the other hand, the portion of their population below 200% of the federal poverty level, FPL, is very high in Mississippi and a lot of these southern states, and is high in Kentucky and West Virginia and New Mexico, but New York is in the next category, and Vermont is in the second lowest category, but yet we have a liberal state. We don't want people to not have coverage, so we've expanded our Medicaid program every way we can. And we have way higher taxes than Mississippi, but we get our people health coverage. Vermont in most years is in the top 3 in health status of their population. Mississippi is not. So Medicaid level, eligibility level for kids expressed as percent of poverty level. So once again, Vermont and Minnesota, Wisconsin, and New Mexico, which is an exception, it's a poor state, but more liberal. They allow children to enter the program even if they are in a higher income family compared to especially Alabama or Arkansas, Louisiana. Mississippi, we said earlier, was a little better in that particular, in the children thing, getting their children into Medicaid. So, but interestingly, all the states that are black are not in these stingy government states. They're in the blue states, states that are willing to pay for, keep their population healthy. Now, this graph shows the increase in Medicaid enrollment between 1987 and 2019. Okay, so the portion of the graph that's in 1995 is due to a little worse economy. So more people lost jobs and got poor. Then over here, 2 things happened. We had a huge economic boom in the last years of the Clinton presidency. And the other thing that happened is they passed the children's health program. So a lot of children got covered by Medicaid. They loosened up the eligibility criteria for children during the Clinton era. So the Medicaid population gradually grew. Anybody want to guess why it didn't abruptly grow after the children's health program passed?
Was it slow enrollment?
Yeah, exactly. People didn't know about it. It's complicated. Who's eligible? Did the state bother creating the bureaucracy needed to get these kids in? Or were they intentionally slowing it down? It's exactly right. It's a process. So this is one of the reasons for lack of health insurance. It's complicated. So, but over those years, they got the kids enrolled. Then it remained flat. The economy was doing okay. We'd gotten up to that level. This is a strong economic era between 2004 and 2007. Then you all know what happened here, right? 2 things. What are they? 2007 to 2012 or so.
A recession.
Yes, there was a recession. And the other thing, anybody know the other thing that happened after 2009?
And the COVID pandemic?
Well, that's later. This one is the Obamacare Medicaid expansion. And the Gabrielle rule that things don't happen quickly, Okay, it's applying here too. So yeah, there's an Obamacare expansion, but kind of takes a while to get people in. So between Obamacare, more and more states got into the expansion, and by 2014, 2015, more and more people. And there's another cause, and that is that through this period, this is the Reagan era. In 1981, Ronald Reagan was elected to be president, and this country turned a very sharp corner. And I think Ken characterized it as neoliberal. I don't know if he got to that, but it's not neoliberal is not liberal. It's it's a less government. Government should be flushed down the bathtub, the famous quote. So less government and less generous social support programs and more policies, deregulatory policies, and lower taxes. Reagan lowered taxes on the rich, George W. Bush did, and Trump did. And the Democrats didn't do much to reverse those. And what I'm getting at is that the social safety nets were being deconstructed to some extent at the same time as the circumstances for the wealthy people in the country continually improved. And income inequality has been a big cause of this rise in Medicaid eligibility.
What does this graph show? Is this like millions of people? Is this a percentage of those that are qualified?
There are millions. This is millions. I'm really sorry the graph doesn't specify.
Okay.
Millions of people enrolled in Medicaid. So by 2020 or 21, the last bar there, you now have nearly 75 million people in the country covered through Medicaid. That's 22% of our entire US population. And there's a lot of people on the conservative end of the political spectrum that think it's appalling. Because it was meant as a safety net program just for people who fall out, or just fall out of getting normal private insurance coverage. So we've already said Medicaid is jointly funded by the government, federal and state governments. There's a match depending on the state's poverty, poverty and overall income matches. And the federal share for the ACA expansion is different, but basically based on poverty. And this slide we've already gone over. They have the different matching rate for different states. And Mississippi has the best matching rate. They don't have to spend very much to get federal money, but choose not to anyway. So I think, yeah, I'll finish with this slide, which is, so it's a state program, and the state, if they improve reimbursement to hospitals and doctors, it's coming out of the state treasury. Unlike the federal government, it can't be paid by debt or something else. It's got to be paid for. States cannot accumulate debt. So the range for state reimbursement to doctors and hospitals ranges from low to pitifully low. Doctors get paid incredibly poorly. Many hospitals and even doctors lose money for many types of health problems when they treat patients insured through Medicaid. All doctors and nurses are aware of the connection between welfare status and Medicaid. Many nurses and doctors regard patients insured through the Medicaid program as welfare patients and treat them as such. The rise of Medicaid managed care has not had much impact. We'll get on that next week, but the idea is the stigmatization, that there's a certain stigma. And the patients, and I would say a third of patients insured through Medicaid know this and feel it. And I don't know that 1 out of 3 is accurate. I think, through the internship, I have ideas for a research project that you could do, because, research is interesting and it's something that's nice on your resume if you want to advance career-wise in certain directions. And every time I have an idea, I'm just going to say it. And if you actually want to pick up on it, get back to me privately. But it would be very interesting to me to know the percentage of people insured through Medicaid who feel like they're treated differently and worse because of their status as being insured through Medicaid. And finally, a lot of times in the hospital, they're instead of referring to them as patients or in some other way or insured through Medicaid, they're simply called Medicaid patients, as if this is a label they're going to take with them for the rest of their lives. And people are on and off Medicaid programs. Some people stay on it, especially if they're disabled, but a lot of times people are on and off it. And it's another feature. A Medicaid patient, that term has I don't know, contempt is the right term, but it has whatever, they're going to behave bad. They're going to smoke. They're going to not take care of their children. It just has a whole stigma attached to it. And it's something to be aware of. Anyway, do you want to ask any questions? We